Rajim. Bismillahirrahmanirrahim. My name is Wasif Naqvi and I am working as project coordinator with SDPI. Thank you very much for joining us on a very important seminar titled Defiant Tobacco Industry and the Future of the Graphic Health Warning. The issue of graphic health warning has become contentious over the past few years as per SRO 22 of 2015, the size of the graphic health warning was desired to be increased to 85% on front and back of the cigarette packs. However, incoordinate delay in implementation caused by the tobacco industry led to the case to be referred to the Islamabad High Court, where it is pending decision for the past 3 years. Pakistan has been a signatory to Framework Convention on Tobacco Control (FCTC) since May 2004, and to meet the minimum desirable standards of graphic health warning, two more SROs 127 and 128 of 2017 were issued, obligating the tobacco industry to increase the erstwhile size of 40% to 50% by 1st June 2018 and then 60% by 1st June of 2019. The implementation in June 2018 was well in time. However, tobacco industry again delayed the implementation on 1st June 2019 and only complied when pushed by the tobacco control regime to increase the size of graphic health warning to 60% by 1st June 2019. For the past many years, Pakistan has been facing growing resistance and influence from the tobacco industry. Claiming to be among the top taxpayers in the country, they have been violating the FCTC rules and domestic laws with impunity. Notwithstanding the political and health dimensions of increasing tobacco use in Pakistan, the complex nature of the violations and non-implementation of laws by the tobacco industry make it unwieldy for any single state or private institution to handle. There are three main points. There are three themes of today's discussion. Number one is that legal and policy frameworks related to graphic health warning and its implications on national commitments made by Pakistan, status of the graphic health warning case pending before the Islamabad High Court. Number second is excessive tobacco industrial clout and consequent defiance of the laws SROs, including consistent delay in implementation of 60% graphic health warnings starting 1st June 2019. Later it would be discussed that which companies are not following these rules. Number third is future of the graphic health warning in Pakistan, including plain packaging option. And for this discussion, we have with us Mr. Waseem Iftikhar Janjua, who's leading this project from SDPI. He's also a PhD scholar with NUST. To his left is Sheikh Faqeer Muhammad Saab. He's Director Division of Controlled Drugs with the Drug Regulatory Authority of Pakistan. To his left is Dr. Minhaj Siraj. Dr. Minhaj is Deputy Director General Health, Tobacco Control Cell, Ministry of National Health Services Regulations and Coordination. And to his left is Mr. Faraz Ahmed, who is working as Associate Coordinator, Coalition for Tobacco Control Pakistan, which is also called as CTC. Now I would request Mr. Waseem Iftikhar Janjua to please start with his presentation on plain packaging problem.
Bismillah ar-Rahman ar-Rahim. Thank you, Wasif, and thank you, esteemed panelists, for joining us here on the issue which is not only of national but international import. And we need to pay special attention to these. In next few minutes, I'm going to talk about the Defiant tobacco industry and the future of the graphic health warning with special reference to the plain packaging. So the sequence in which I'll cover my talk is flashed in front of you. I'll just give you the overview of the project that SDPI is conducting here in collaboration with Bloomberg and the Union. And then I'll talk about plain packaging, its history and implementation around the globe. Then few words about the evidence in favor of the plain packaging and industrial resistance and prospects of plain packaging in Pakistan. We'll discuss further as we have question answer session as well, but I'll just briefly talk about it. So basically, SDPI is doing this project in collaboration with the union, which is warning on tobacco products capacity building within legislative framework. And the Bloomberg Initiative to Reduce Tobacco Use grant program is jointly managed by the International Union against Tuberculosis and Lungs Disease, the union, and CTC. If the current global trends continue, tobacco-related deaths will number around 1 billion in 21st century. Tobacco kills more than 6 million people each year, almost 14,000 people every day around the globe. More than two-thirds of the tobacco-related deaths occur in low and middle-income countries, and that is where we, as Pakistan, come in. As per our tobacco control cell, and Dr. Minhaj Saab is leading the cell, and the World Tobacco Atlas, 160,100 people are killed by tobacco products every year in Pakistan. Despite this alarming figure, over 24 million users continue to use tobacco products in smoke as well as smokeless forms. That is Naswar and similar products. And they smoke more than 85 billion sticks of cigarettes every year. Pakistan is a signatory to FCTC, as has been highlighted by Wasif Naqvi, which is a framework convention for tobacco control, and it came into effect in 2004, and we have been signatory all along. The government has issued multiple SROs and made laws targeting the smoking spaces, ban on advertising, graphic health warning, etc. However, the major problems in Pakistan are lack of implementation, promulgation of robust tobacco control laws, excessive tobacco industrial influence, resulting into massive tax evasion, and lack of tobacco control knowledge and capacity among the legislators. So with this, we are basically, the purpose of our project is to build and strengthen capacity of legislators and relevant organizations working on policy reform and its implementation for tobacco control, including the issue of graphic health warning on imported and smokeless tobacco products. Coming over to the plain packaging, some of you might be aware of this concept, but just to refresh, it's a standardized, homogeneous, neutral, or generic packing. And it removes all the branding, including company logos, trademarks, colors, and everything that make a tobacco pack attractive. It standardizes the brand names and uses standard color, font, and size of the company names. And the color which is displayed here is known as DRAP, brown, Ponten 448, which is also known as the ugliest color in the world. So they basically have proposed this color to be used for the tobacco pack, standardized all around the world. It only allows health warning to be printed along with the legally mandated toxic constituents and tax stamps, etc., which are mandated by the governments in their own regulations. So it limits the scope for brand attraction and advertising through the packaging, because this is a major problem that our youth or anyone who starts smoking, they are attracted by its shape, size, color, and other branding gizmos. Plain packaging was first suggested in 1989 by New Zealand. They did not actually implement into law. Then the further research was carried out in Canada. Again, they tried to implement this, but they could not do it then. As a matter of fact, Australia became the first country in 2012, December of 2012, that the plain packaging was fully implemented, and all the products which are being sold, smoking products which are being sold in Australia, they are supposed to be plain, and they are supposed to follow the guidelines laid down by Australian government. Australia has set many good examples in tobacco control regime. For example, they have also mandated it as per the law to raise the price of one pack of cigarette to $40 by 2020. So, which is a lot of money to be paid for one pack of cigarettes. Okay, the next country is Hungary. In 2016, they started following. They laid it into law, and May of this year, Hungary has also converted to plain packaging, which means that all the cigarettes which are being sold, they have to be in this shape and form. France plain packaging is fully implemented. It was implemented in 2017, and cigarettes sold must be in plain packaging. And Slovenia laws on plain packaging are in place, but they'll be implemented in 2020. they'll take effect from 2020. UK plain packaging is fully implemented. All cigarettes sold must now be in plain packs, and UK is one controversial example because the British Tobacco Company, which have their headquarters in UK, they were busy here in Pakistan in lobbying as well, and the British High Commissioner met our finance minister here to implement certain policies which were detrimental to the tobacco control regime. But in their own countries, they are smart enough to implement the laws which are the most stringent laws possible. Norway, 2018, they implemented this thing, and similarly, Ireland, plain packaging is fully implemented. All cigarettes must be sold in plain packaging, and Turkey is also another inspirational example, and they have also converted to plain packaging. Other than that, Belgium, Canada, Colombia, EU, India, which is a regional example, Malaysia, Mauritius, the Netherlands, Panama, Philippines, Saudi Arabia, Singapore, South Africa, Switzerland, and Thailand all have laws in place, but they have yet not been implemented. So we are hopeful that they are going to be implemented soon, or they'll update their laws soon. Unfortunately, Pakistan plain packaging is not at our card as of today. All cigarettes must be sold with 60% of the pack, front and back, covered with the graphic health warning. And you must have seen it with your friends or anyone who smokes, that this used to be really small. It used to be 40%. Then we took up then it was suggested, it was an SRO, that it will be raised to 85%. And tobacco industry raised a lot of hue and cry, and then it was that case is pending, and Faraz is going to talk about that case subsequently. But as of now, today, we have mandated all the tobacco industry or tobacco products to have 60%. Not all the tobacco products, just the smoking tobacco products. We do not, just to mention, we do not have any laws for smokeless tobacco like Naswar or chewing tobacco. Pakistan implemented, we have been very good at implementing or promulgating the laws. The first laws for health warning was brought into force in 1979. And you must have seen that all along, which said that smoking is injurious to health. Ministry of Health, we used to have a message on the side of the tobacco, both in Urdu as well as in English, for most of our life. But starting 2010, we also started printing pictures, which is in line with the FCTC's requirement that Pakistan is signatory to. Similarly, we were one of the first countries to implement a major health ordinance which targeted the smoking spaces, smoking advertisement, and things like that in 2002. The rest of the world was not and had not done this kind of work earlier. But unfortunately, we have excessive tobacco influence on us, and our policies tend to be flawed, I must say. Even this year, if some of you noticed, during just before Ramadan, Prime Minister was presented with a check of 5 million by one of the tobacco industrial representatives for the Amir Bhasha Dam. So in corporate social responsibility, they show off to be one of the leading agents, but the problem is that after all, they are killing us left and right. So our point is that such influence, and they are not supposed to do that, by the way. As per FCTC laws, the government is not supposed to accept that money, and they are not supposed to give that money. They may be from America, like Philip Morris is an American company, and we have British Tobacco Company, which is from England. So the major focus in previous seminars and conferences we have also been emphasizing has been the sluggish implementation. We have the laws in place. We definitely need to improve the laws. I'm not saying that these are the perfect laws, but then implementation remains a big question mark, and that needs to be handled. So now, with this, I come to the end of my presentation, but just a word that we have friends here, and we keep talking to them off and on, and in other meetings and conferences also. But so I am actually here in SDPI. We are going to start working on plain packaging with collaboration, and thankfully our friends who are sitting here with their support. So we are looking forward to that help. Thank you very much. Thank you, Wasif.
Thank you very much, Waseem Saab. Now I'll come to Mr. Faraz Ahmed, who's working as Associate Coordinator, and I would request him to share his thoughts on the plan package.
Well, I'm basically here to represent CTC to talk about the case we've got pending in court. And at the moment, or rather for the last 3 years, they've just been hanging us. Initially, we thought it would be a smooth process, especially after, as you mentioned, British America Tobacco coming to, and then the High Commissioner coming and meeting the government, especially the Finance Minister. We actually thought it was worth going for it. Now, initially, the judge said yes. The first hearing was very positive. We thought, yes, we'll get an outcome. By the time we reached the second hearing, Pakistan Tobacco Company said, we want to be party to the case. And it dragged on for 5-6 months. We kept objecting that what's their role in it? We're talking to the government. They said, no, we are party because it's our product. Eventually, the judge allowed it. Now, the most recent update on that is we actually finally got to give our side of the story. We presented our arguments in February. And since then, they said, yes, now we'll hear the PTC's arguments later. The judge was kind enough to even say that whatever change comes through SROs, let it be for now. If it's positive for you, we'll let it stay. If the decision comes in your favor, which we thought it's going to come, especially after the last hearing, we'll implement those as well, and 85% will be there. But since then, it's been, you can count the months yourself, February till today, October, there's not even been a sign of a hearing. And as far as plain packaging goes, I agree with you, it's a long way off, but if we keep resilient, you never know. Considering our history shows every time there's been an armed forces rule, we've got something implemented. Who knows? We might be going that way again because it seems like they're dominant here too. That's all I've got to say. Other than that, I can answer any questions regarding the case you've got.
Thank you very much for being so brief, Faraz. Now I would request Sheikh Faqeer Mohammed, who's working as Director Division of Controlled Drugs with DRAP.
Dealing with the controlled drugs division in the DRAP. And I think as a regulator, we do have a role to the extent that at least we can give suggestions, we can hear, we can participate, our recommendations sort of. So for that purpose, as scientific, you see, point of view, Mr. Janjua Sahab, he has very elaborately mentioned the consequences, the development in the globe regarding the regulating of the use of smoking or tobacco. He mentioned many names of the countries. I think if we people in Pakistan, and Dr. Saab is here, mashallah, he is doing a lot. And since Dr. Saab is in his place, we have been listening and hearing that a lot of things are being made and very good progress in its pace. So I do actually say that because the tobacco as such, because being a person associated with the control of controlled substances, INCB, International Narcotic Control Board, actually we have, which regulates or gives guidelines and recommendations regarding the use and control and regulation of the narcotic drugs and psychotropic substances in the world. Since this cigarette or the smoke, when we say that it does, still it is not included in the ambit of controlled drugs as per definition of the International Narcotic Control Board. So for that purpose, actually, this is excluded. However, as this makes also habit forming and for the users, so for that purpose, and being a student of science or medicine, we can say that many injurious, I think it's a very perhaps little word, because it has far-reaching consequences in the field of smoking. what smoking gives or reflects to the subject or to that human, that person who smokes in various sort of types. It has many physiological disorders, many diseases, and I think I don't know this forum has that scope or not, but sort of cardiovascular diseases, liver diseases, and the lungs diseases. So many diseases are associated, especially with the use of this tobacco. So when we are here, we collectively, Dr. Saab, inshallah, he will also give his, you see, the development which the Ministry of National Health Services is doing. Then we will be able to conclude something. So for these words, thank you so much.
Very much, sir, for your kind words and bringing our attention towards the injurious effects of the tobacco and psychological disorders and cardiovascular disease, etc. Now, at the end, I would request Dr. Minhaj Siraj, who is Deputy Director General, Tobacco Control Cell. Sir, you have all the crux of the discussion, and now you can shed some light on it. Thank you very much.
Bismillah ar-Rahman ar-Rahim. I'm very much obliged and thankful to the SDPI for arranging this seminar. Definitely, the government only or the state cannot fight these mafias alone. And civil society and forums like SDPI, they have been very, very instrumental. Things get so much tricky, and I will quote one example. When I was drafting this organ transplant law, Pakistan was labeled as a kidney bazaar. Supreme Court takes notice of that, and then they push us, okay, fine, do some legislation. One fine day it gets through the cabinet, and we have to table the bill in the National Assembly. To my horror, that morning, my health minister, the Parliamentary Secretary, and the Minister of State, none of them appears in the National Assembly. And that is 7th of August 2007. Still, I request somebody else, Sheriff Ganyazi Marhum, knew him somehow. Sir, this is an important bill. Can you please table it? He asked me, agenda te aaya hai? I said, yes sir, it is on the agenda. मैं पढ़ देता हूँ, ठीक है doctor, सुझाव. So that's how the things went ahead. Story at the government is totally different sometimes. And I will recall another example related to tobacco control. In 2016, one of our friends from civil society, a good and well-known organization, they tried to propose some amendment in the legislations. And believe me, for the last almost 10 years, and if I'm not wrong, for the coming at least 10 years, the good legislation are not going to be there, because there's a discrepancy in the terms of the lower house and the upper house. It's always a difference. If they have a common interest, then yes, it goes through. Otherwise, the government has to rely on ordinances, bypass the parliament. Table a bill in the lower house, it gets rejected in the upper house. Table on the other side, goes down in the lower house. That's how things working. And I requested that organization that please don't do that, because if at this time there is an instrument in our hand, and that is the ordinance of 2002. If we try to get some amendment into it, if the amendment is tabled in a proper forum and it is referred to a ministry, the whole structure will go to a standstill. And by the time it keeps on rolling here and there, industry will have all the playing grounds around them. That will be heaven for them. Things exactly happened like that. Waseem Saab knows it better. So, why we have been relying so much on SROs? That is the main reason. 26 of them till now. Because for that we have to only get it through the cabinet and go to a lower level legislation, go ahead. Same goes with the pictorial health warning. We are enhancing it through SROs. The government then comes the role of when we announced that okay, fine, we are going to do it for 85%. WHO was very happy. All the tobacco control advocates in the world, yes, Pakistan is going good. And then British, our rulers. I'm sorry, there is no British affiliate here. They ruled us. They ruined us. 1938, they start cultivating tobacco in those areas where they cannot win with the sword or gun. They made them addicted in the northwest of the subcontinent. And then, okay, fine. One fine day they think, yes, you are growing tobacco, that's a harmful product, damages public health. Believe me, sir, in 1938, the British knew that it's harmful for public health. And they imposed a fine on us, on the tobacco growers or the vendors. The Tobacco Vendor Act, 1938. Preamble starts from this word, in the interest of public health. That's what British has been. Still they are doing that. Although we managed to transform that tool of, you can say, the legal tool into our benefit. We took it from the archives. West Pakistan implemented that in 1958 just to earn some money from vendors. In 2015, we took it to the Chief Commissioner Islamabad, sir, we want to get the tobacco vendors licensed. And as everybody knows, in a person like me in a health sector, I'm not fighting with a bacteria or a virus like a malaria control program or an AIDS control program or a TB control program. We are pitched against big tobacco. They can buy us, they can bury us. So, with that vendors licensing, we could achieve which nobody had ever dreamt of. 6 countries of the world are now following this, including India. And one state of USA last week, they have also said, yes, we are going to license the vendors. Because the data, the control, and mind it, sir, how much is the spectrum of control on tobacco? In the year 2000, Pakistan wanted to get rid of the stigma that it's a drug-producing nation. Drug-free nation, fine, we got it. At the cost of growing tobacco in those areas where poppy was being grown. Lesser evil, let's grow tobacco, don't grow poppy. But still, lesser evil is also hurting. So, the things have been changing. We have a Pakistan Tobacco Board, a legal entity, to make sure that every leaf of tobacco is sold. It doesn't go waste. We have FPR. We are collecting money. Cash-strived economy, going down and down. 111 billion rupees coming. Why are you crying? They're not interested in the health. My desk is also responsible for the medical reimbursement of the federal government employees. That's my basic, you can say, assignment. And I exactly know when a bill from a cardiac patient or a cancer patient comes, how much it amounts. That amount is going from the government's kitty. If we are getting 1 billion, it's 0.4% of the GDP. How much is that? Still, the thing is that so many tricky things keep on going. My friends from the civil society, they prefer to go against the government because the British ambassador and his cronies, they could motivate and manipulate the finance minister, and yes, okay, fine, let's drop it. Don't do that. First go for a opinion survey. And mind it, sir, opinion surveys like that, they're always tobacco industry engineered. Like the drugs dealers do that. 2 years back in Islamabad, one fine day in the morning, we read that there are about 65 to 70% students using drugs in the higher education institutes of Islamabad. What was the rationale of that finding? A lady whose own son was a drug addict died of overdose? Motivationally. Did that survey. Rolled everything upside down. When UNODC was doing the World Drug Report 2014, I requested the drug report writer, because he happens to be my roommate, my class fellow, that please add tobacco into that. UNODC doesn't do tobacco, but still we managed to add a full questionnaire related to tobacco use. And believe me, sir, there is about 7% of the users drugs and about 11% students who are doing smoking tobacco in our education institutes. On the other side, when the FBR comes, every time they come up with a report, Nelson report, engineered by tobacco industry, there is a 50%, 45% illegal tobacco being sold in the country. No, it's not like that. So many of the research studies in the last 2-3 years, they have proven that the illicit tobacco trade is hardly 14 to 15%. Tobacco industry wants that we are owning, or we are having a 80% market share, 82%. The rest 18% is going to the illicit trade. That should be ours also. And they managed up to the extent that when you see a half-page ad against illicit tobacco from FBR, that these are the smuggled tobaccos, or these are the fake ones, and if you can report it to us from FBR, the cost of that ad is paid by tobacco industry. That's how deep-rooted their infiltration is with the system. We are not disheartened. You are with us. That's our strength. Every time it happens, and most of my civil society friends who are tobacco control advocates, mostly they ask one fine day, they wake up to see, and oh, there's this huge news flash mentioning them. It's from them. Sir, ye kahan se aa gaya? Please keep quiet. I want your help. As a government officer, I cannot say it on my own. So, civil society, thank you. Coming back to this issue, Waseem bhai, you mentioned that the thing is that you're going to work on smokeless tobacco also. This one tool, which is the Tobacco Vendor Act, when we implemented in Islamabad, I said a public health intervention, that we developed, or we drafted an affidavit for the vendors, that we will abide all the tobacco control laws in the country if we want to sell tobacco products, and that includes smokeless tobacco. So they do not sell it to under 18, they do not sell loose cigarettes, they do not sell it near educational institutes. We do not give licenses to the vendors who are within the boundary walls of 50 yards of the, because the law doesn't allow that. So coming back to this graphic health warning thing, basically when we, this year happened, that we enhanced the picture size 60% from 50%. Tobacco industry, when the grace period lapsed, they started writing to us. Every day I was receiving at least 8 to 10 letters from different wholesalers all over the country. We have such a huge stock in our backyard, so we cannot sell it till your deadline, so please extend the deadline. To all of them, my reply was only one-liner. Your request has been considered but cannot be exceeded to. Simple one-liner. The government works like that. Everybody sent it back. Half of them came back, wrong addresses. But the industry has been running away from us all these years, not giving us any data of their retails or their warehouse storage. These letters gave us the data themselves. So I tell my friends, oh, you want the data of the retailers all over the country? Here it is. They have given it you just themselves. So let's tabulate it. But still, things goes on. And coming to the legal procedures, this is a universal phenomenon. Big tobacco works like that. And caches on our, whenever we say कि जी आपको अदालत से क्या मिलता है? तारीख. They are doing it universally, everywhere in the world. So we have to be more proactive on that. Have to do some serious work. Another hard issue was going on, and that was like when we started talking about implementation of the laws. We had all our police stations enlisted with us. We trained the concerned officer. They gave us focal persons. One of them was very much convinced, and one fine day he raids a warehouse, takes 4 containers of electronic cigarettes, confiscates them, puts the owners in jail. And then they come, they ask for a bail and then come to Islamabad High Court. And when the case was presented, it was basically against the Chief Commissioner of Islamabad and the IG police. So I went to the court and I requested that, yes, I want to be a party. The Ministry of National Health wants to be a party. So the court has accepted that, and hopefully on the mid-December, we are going to confront that, because you exactly know what electronic cigarettes are doing. Vaping is killing people, and we have so much data. Still, here again comes the hypocrisy of Britishers. British government is supporting vaping, electronic cigarettes. They are still confusing people, confusing scientists, confusing us that it is helping to quit smoking. Additives, so many things, killing people. America is banning, India has banned the region. They are more alive to these products. They say, no, it's fine with us. You can vape, you can use electronic cigarettes because it will help you to quit smoking. Coming to DRAP, we are very, very thankful to DRAP. It took us about 3 years to convince them that nicotine is an addictive substance, and the replacement therapies or detoxification processes has to be carried out. And last year, December 2018, they have included the nicotine replacement therapies in essential drugs list. And Shaikh Saab please correct me if I'm wrong. Being in essential drug list means that it has to be freely available and it has to be at a certain price limit. Before that, they were very, very expensive. They were not available. Now the nicotine replacements, chewing gums and all patches and everything, they are openly available in market thanks to the DRAP. Yes. Now they have considered it that yes, it is an essential drug. So the thing is that I will sit down with this our friends from CTC, and we'll find a way out, inshallah, to go to the court and try to fight it out. They are trying to make the government responsible for that. Yes, it is our duty, and we have to do it. Thank you very much.
Thank you very much, Dr. Minhaj Siraj.